Welcome to AHAR Consultant YouTube channel discussing on COVID-19 and engineering series. This episode is slightly different from our previous episodes as we will be discussing on legal matters related to this COVID-19 pandemic. Specifically, we'll be discussing on the legal issues on employers' duty to provide safe work environment. As safe work environment is related to engineering, we think it is very important that we can see the consequences if engineering solutions are not taken seriously in the operation of building during this pandemic period and perhaps becoming new norm post-COVID. We will be referring to a newsletter published recently by our friends law firm RDS Associates, Advocates and Solicitors, Rosli Dahlan Saravana Partnership. This article is written by its senior associate Mr. Louis Liao, who is responsible on employment and industrial relation practice. Here are some questions that need to be asked. Is an employer liable if your employee falls sick due to transmission of COVID in your workplace due to inadequate mitigation measures? Is property owner or property manager liable if any tenant gets infected by COVID-19 due to infection from the central air conditioning system? What are the liabilities that fall upon the employer or the property owner or the property manager? We will present to you the legal opinion from RDS in answering these questions. First and foremost, employer has a statutory liability under the Prevention and Control of Infectious Disease Act 1988, PCIDA. Under this act, an employer is required to abide strictly by the regulations made by the Minister of Health during a pandemic. For example, during the MCO, the minister may instruct that only certain type of business or shops are permitted to be open, or the operation period may be shortened or closed up to a certain time. The company's officers at managerial level must ensure that all regulations are complied with by the employees. Failing so, the company and the director, partner or manager may be charged in court. If found guilty, they may be fined not more than 1,000 ringgit or imprisonment not exceeding 6 months or both. Secondly, as we mentioned in episode 7, under the OHS Act 1994, it is the duty of the employer and every self-employed person to ensure, as far as practicable, the safety, health and welfare of all his employees. Employers, building owner and building manager are duty bound to ensure that the workplace is safe and has minimal risk of exposure to pathogens. This includes ensuring the indoor environmental quality parameters falls within the prescribed levels. Under this act, a person who contravenes the provisions of Section 24 shall be guilty of an offence and shall on conviction be liable to a fine not exceeding 1,000 ringgit or imprisonment for a term not exceeding 3 months or both. There is an employment contract between an employer and employee. An employer is required to provide a safe workplace to his employees. In the case of Melawar Corporation Berhad versus Abu Osman in 1994, the industrial court held that an employer owes a contractual obligation to his employees to provide a safe and conducive working environment. It can be inferred from this case that if a workplace is found unsafe and has high risk of infection from a deadly virus, the employer can be considered as breaching the employment contract. As engineers, we are familiar with the duty of care to the public. Similarly, under the common law, an employer must take reasonable precautions to protect his employees against danger. It is expected that he provide reasonable workplace for his employees. An employee may sue the employer or building management if he gets infected by COVID, if found that the workplace does not practice reasonable measures in protecting the tenants. You may have instituted personnel protection control at your workplace. However, these control strategies are the least effective from the hierarchy of control pyramid. For the last 10 months, we have been wearing masks, washing our hands, social distancing, using virtual meeting platforms. Yet, we see the infection cases are still very high. It is reported recently that the new infections not only happening on high-density spaces like dormitories and prisons, but coming from offices and factories. What happens when more people start coming back to offices or hotels start to open up again? More engineering control needs to be done. Engineering control may be able to isolate people from the hazard through removing the opportunity for pathogens exposure to humans. As we mentioned in our previous videos, we list down again various engineering methods that can be employed. Control of temperature and humidity. Consider using dehumidifier in the spaces. Ensure that your system is in good operating conditions. Install enhanced filtration system in your air handler. Install UVC light in your offices. Use pressurization. Improve your ventilation system. Have physical barriers between your workers. You may use airflow pattern and direction control in order to prevent the spread of the virus. You can also use air dilution and flushing for your buildings. Establish exclusive zones. Review design parameters for future buildings. And last but not least, the enforcement of the IEQ. This list may not be exhaustive, as new technology may come sooner or later. We cannot expect vaccination will completely solve our problems. Likely, we can only get vaccinated by the end of the year. Even with the vaccination, there could be new COVID strains coming out as we speak now. Are we going to be reactive? This is the new norm. That would be all for this episode. If you found this helpful, be sure to hit the thumbs up below. If you are new to our channel, be sure to subscribe and turn on the notification. Until we meet again in the next episode, kita jaga kita. Thank you.